Welcome to Autolytic, unlocking the secrets inside your body and brain. Hello everyone. Welcome to Autolytic, unlocking the secrets inside your body and brain. In this video, we'll cover a core surgical topic. How to do wound debridement. This video is designed for medical and surgical students, focusing on concepts, indications, and technique in a clear and exam-oriented way. What is wound debridement? Wound debridement is the removal of dead, devitalized, infected, or contaminated tissue from a wound to promote proper healing. Dead tissue delays healing, encourages bacterial growth, increases the risk of infection and sepsis. A wound cannot heal unless non-viable tissue is removed. Why is wound debridement important? Debridement is important because it reduces infection, improves blood supply, promotes healthy granulation tissue, enhances the effect of antibiotics, prepares the wound for closure or grafting. This is especially important in diabetic foot ulcers, pressure sores, traumatic and infected wounds. Indications for debridement. Wound debridement is indicated when there is necrotic tissue, slough or eschar, infected material, foreign bodies, chronic non-healing wounds. Common clinical examples include burns, infected surgical wounds, and diabetic ulcers. Contraindications. Debridement should be avoided or done cautiously in dry, stable eschar with no infection, poor vascular supply, uncorrected bleeding disorders. Always assess vascular status before aggressive debridement. Types of wound debridement. There are 5 main types. Surgical, sharp, debridement. Scalpel or scissors. Fastest and most effective. Mechanical debridement. Wet to dry dressings or irrigation. Autolytic debridement. Uses body's own enzymes. Slow but selective. Enzymatic debridement. Chemical agents break down necrotic tissue. Biological debridement. Maggot therapy. Note: for surgical students, sharp debridement is the most important. Step-by-step. Surgical wound debridement. Step 1. Patient preparation. Obtain consent. Examine wound size, depth, and infection. Ensure adequate blood supply. Step 2. Anesthesia. Local anesthesia for small wounds. Regional or general anesthesia for larger wounds. Step 3. Wound cleaning. Irrigate with normal saline. Remove surface debris. Healthy tissue. Pink. Bleeds on touch. Necrotic tissue. Black, brown, gray. Does not bleed. Step 4. Debridement. Use scalpel or scissors. Remove all non-viable tissue. Continue until healthy bleeding margins appear. Preserve viable tissue. Step 5. Hemostasis. Control bleeding using pressure or cautery. Step 6. Wound management. Decide on secondary healing, delayed closure, skin grafting. Apply appropriate dressing. Complications. Possible complications include bleeding, pain, damage to healthy tissue, infection if asepsis is poor. Remember, a wound that is not clean cannot heal. If this video helped you understand wound debridement clearly, subscribe to Autolytic. We simplify anatomy, surgeries, and medical science for students and curious minds. Unlocking the secrets inside your body and brain. See you in the next video.